Hi, I'm Dr. Scott Gray, and I'm the owner and founder of Back in Motion Sport and Spine Physical Therapy here in Fort Myers. And in this quick video, I want to explain the signs and symptoms of a herniated disc. So before we go a little bit deeper into the signs and symptoms of a herniated disc, let's talk about what a herniated disc really is. So a herniated disc really is synonymous to a jelly donut. So the disc is what's in between our vertebrae or our spine bones. And so you've got an outer hard layer called your annulus of the disc, and then you have the inside part called the nucleus pulposus. And so the nucleus pulposus is like the jelly, and the annulus is like the outer hard layer of a donut. So sometimes we get an injury, whether it be an athletic injury from sitting too much or we bent incorrectly and twisted incorrectly. The nucleus can then herniate outside of the annulus. And so basically the annulus tears the outer layer, and then the jelly gets compressed or leaks through that little annulus crack, and then it can compress a nerve root. So you get then a herniated disc. And so the signs and symptoms typically include numbness, tingling, you'll have weakness, pain with flexion or rounding or sitting of our spine, and you'll be worse in the morning. But usually there also is what they call a mechanism of injury. So let's talk about that. So the disc, the annulus, the outer part, gets put on a lot of tension anytime we go through a flexion and rotation component of our spine. And what this does over time, or whether it's a lot of force, it can tear that layer, and then that jelly then can leak through and compress the nerve root. So there's usually some sort of mechanism of injury, or you've been sitting for a prolonged period of time, and that can also increase the tearing of the annulus. The second thing you'll see is numbness. Since it's a nerve injury, you'll typically see numbness either into the posterior buttock, the leg, the calf, etc. You'll then see tingling. So tingling is just like an altered sensation from the nerve, and it's because the nerve and its fibers are irritated from the nerve root being compressed at the spinal level. So you'll usually see a different type of output at the nerve and get tingling sensation. And then sometimes you'll also see weakness because it comes from the spine. You can see, where muscles are weak. For instance, if the spine lesion is at L5, you'll typically see weakness of the big toe, or you might even see it at the ankle. So just really kind of depends. That's why a physical examination really is important, because then you can discern what the spinal level that the injury has occurred, because if there's weakness at that level, then we can really discern where it's at. The next thing you'll see commonly is pain with flexion, because the most pressure is put on our disc anytime we flex our spine or sit. You're going to have increase in pain and signs and symptoms. So typically patients who've been sitting, who they try to reach out and touch their toes, they can't do it when they have a herniated disc, because again, that's putting increased compression on the outer layer of the annulus, which is innervated, but also it's putting neural tension on that nerve root that's really irritated and inflamed from the nucleus pulposus that has come through that annulus fibrosis. So then the last thing you'll see is you'll have pain worse in the morning. And this really is because the disc swells when we sleep at night. So when we're laying down at night, all this fluid rushes into the disc and it swells it and puts more pressure on the nerve root. So typically patients who've got a herniated disc, they'll complain of waking up in the middle of the morning, or it's just really hard to get going in the day, early on in the day, and their symptoms are usually exacerbated early in the morning. That's because the fluid is rushing into the disc. So typically as the day goes on, their signs and symptoms will just decrease. So there you have it. Those are the symptoms of a herniated disc. So typically you're going to be a younger patient, and this is because the disc hasn't dried out. So patients typically 60 plus and above don't get a herniated disc, but young people like myself in their teens, 20s, 30s, and 40s, and even into their 50s will usually be the type of patient demographic that you'll see who have a herniated disc. There usually will be a mechanism of injury, so there'll be a flexion or rotation component typically, or it's been with a prolonged sitting. You'll then see numbness, tingling, potential motor weakness and loss. You'll have pain worse with flexion or sitting, and then you'll typically be worse in the morning.